Hello viewers and hello listeners. Today we will talk about cognitive behavioral therapy. Cognitive behavioral therapy is a therapy that always try to change our cognition and also the behavior. So it will try to change our cognition and the behavior in a parallel way. Whenever we will do the therapy on a patient, we always try to do the thing that will change the cognition and the behavior. Because it is a CBT, cognitive behavioral therapy, the motto of this therapy is changing the behavior on the base of the cognition. So we will always try to do the change of cognition for changing the behavior, because the main thing of the therapy is changing the behavior. And this type of the therapy always believe that we can change our behavior on the base of our cognition. Whenever we will try to change the cognition, automatically our behavior will change. So cognitive behavior therapy, it is a short term and also the goal oriented psychotherapy. Because short term, because we always take a short term period, not a long expansion of time to treat or change the behavior of the patient, basically the modification of the behavior of the patient. We don't do that. We always try to have short term goal on the patient to achieve that goal that we want to achieve from the beginning or from the planning of the therapy. And also it is a goal oriented. Obviously, whenever we will or we are doing some therapy or something like treatment on the patient, we always have some goal that after 2 months or after 3 months we will achieve these goals that we don't have now this time. And also after this period of time we will achieve the main goal or the main motto of our treatment or the therapy. So this is a goal oriented therapy. And also it is a hand on practical approaches to solve the problem. Hand on practical approaches, because whenever we try the CBT process, we always try to we always try to tell the patient that you have to solve your problem and you have to change or modify your behavior on the basis of the practical examination, a practical example of your daily life. So whenever we are trying to put some therapy or the treatment on the patient, we always try to have some practical approaches to apply the therapy. So it will be very helpful for the patient to become a healthy, more healthy and a better person. And it is a change pattern of thinking. because it is a CBT process, it always try to change the behavior, but it always believe that we can try or modify our behavior only when we will change our cognition. So when we will change our cognition, automatically we will change our behavior. So it always try to change our thinking pattern or the process to change the behavior. After that, it a process that always try to handle the people's feeling, like depression, sleeping problem, relationship issues, anxiety, substance abuse, low self esteem, various things are there. So all these things, in all these things we always try to keep and always try to say patient to achieve all the things in real life situation. Okay, after that there is some negative thoughts that we can see in the patient. Whenever we try to put the CBT therapy on the patient, we will observe or we can observe some negative thoughts that we have in the patient. For example, I am so stupid, I cannot deal with this, nobody loves me, I am so ugly, I am not worthy, I am a bad person, this is all my fault, this won't end well for me. These all are some examples of the negative thoughts. Some negative thoughts are there, for example, like for example, it's not always regarding I, it also can regarding any situation, regarding any occupation, regarding any jobs. Basically, whenever we try to put the CBT therapy on the patient, we will see there will some negative thoughts, and that thoughts come from the self, that thoughts come from the situation, and also some in various area of our life. So these all the things that if a person try to change in his or her life, that can change his whole life orientation, and also the possibilities, the opportunities, and also the going pattern, thinking pattern, and also solution of some problem. That will very helpful, and that would be very grateful for the person itself. So after that the thing is practicing new skills. Whenever we are putting some therapy, it's like cognitive behavior therapy on the person or the patient, the important thing is that practicing new skills. Practicing new skills is like uh, up, uh, for example, I am trying to solve a solution in something way, and and the CBT always try to say us that if you are trying to if you are trying to solve some problem in your way, change that pattern to solve the problem. For example, if you are trying to solve a problem by the help of plan A, now you please try to solve the problem by plan B. Change your pattern of solution of the problem, change your pattern of planning of the solution of the problem, so that will helpful for you or for the patient. So whenever we are putting the cognitive behavior therapy on the patient, practicing new skills to solve the problem would be very helpful for the patient, and it will be very good coping mechanism. Okay, it is very important to practice new skills and that benefit us in the real world. It is a very good coping mechanism. Traumatic situation, for traumatic situation it will be very grateful for us, and also it helps us for the healthier life, for mentally and somehow also in case of physically. So after that, problem solving technique. Problem solving technique, whenever we are trying to put the CBT therapy on the person, we are doing the practicing new skill, we are trying to change our pattern of plan, we are trying to change our solution of the problem, we are changing that area, we are not running through the same process, we are trying the plan B, plan C, plan D for various type of the solution of the problem. After that, we also try problem solving technique for CBT therapy. Not CBT therapy, we will try to put the problem solving technique when we are trying to put the CBT therapy on the person. So when we are trying the problem solving technique, we first of all we will try to identify a problem. Okay, so at first we learn practicing new skill, and first point was that practicing new skill, and that point practicing new skill tells us about that whenever we are trying to cope something, we are trying to solution, we are trying to give or want to view some solution of a problem, we will try new skill to solve that problem. That was the first one. Second one is problem solving. How that we can the problem solving, and this is the main problem main problem of our life is that problem solving. So whenever we are facing some problem, first of all we will try to identify a problem. For example, I am facing some problem for like exam, maths exam or English exam, or I am trying to do some job exam, or I have something like assignments on our university or presentation in our office. So whenever we are doing something work on our educational place or workplace, we are doing something work or job, and whenever we are doing something work, we are facing something new experiences, and that new experiences is cannot be our for our known things. That's why it is new. So whenever we are facing something, we have to first identify what is our problem. First of all thing, what is our problem, that I have to identify. So whenever I am doing assignment, I have to first of all I have to identify what's the main problem I am facing. So that's why that assignment making me difficult for doing or completing that work. Whenever I am doing some presentation, I have to identify the problem that I am facing, that making me difficulty for presenting that map or the presentation in our office place. After that, making out some possible solutions, we have to do some possible solutions of that problem. First of all, we did the problem, identify problem, we did that step. After that first step, the second step is that possible solutions or the possible outcome. For example, assignments. For example, I want to complete that assignment, and I already identified the problem that I am facing for assignment, and after that I will try to find out what's the possible solution can be for this problem. Okay, after that, evaluating strength and weaknesses in each option. For example, I have some difficulty that I already identified, then I have made some options or possible solutions of that problem, and now I will evaluate each option, and I will evaluate whether it has any type of the strength and weaknesses of each options, and if all these options have, or one option has any type of the thing, I have to evaluate what's the strength and the weaknesses of each option we have. Okay, after that, choosing what solutions to implement. After all of this scrutiny, that these options have these problems, these options has this positivity, after this scrutiny or the evaluation, we will try to make an implementation of the possible solution or the possible outcome. That's the most better and the possible and also the easy solution of that problem that I can make happen, that I have to choose. After that, going through with it, so I will choose my option and I will implement that. So after that, the thing is the goal setting. So whenever we are doing the CBT, our main motto is changing the behavior, and for changing the behavior we have to do the changing the cognition. So whenever we are practicing something new skills and we are trying to modifying our thought pattern or the thinking process, we knew the two options. First was the practicing new skill, and second was the problem solving. After that, the third was the goal setting. And for goal setting is a very important thing for the CBT, and that helps recover from an underlying mental illness. That's obvious things, because whenever we have a goal in our life, that make us possible to go through that line, that make us possible to go through what I can say, a disciplined life in our day-to-day action. And whenever we don't have that day-to-day thing or day-to-day a routine in our life, that make us very much hazardous, and also make very much hassles in our day-to-day life and also overall life. So we should have a goal setting thing. If a person is happening or facing some anxiety or any type of the trying to change the cognition, because trying to change the behavior is the most important, so he or she can do one thing, doing a short term list for day to day thing, for Monday, for Tuesday, for Thursday, for each day we should have a short term goal. And the person who are facing anxiety in day to day life, that to do list can be very helpful for the person. For example, for the Monday, the person will make some to do list, that this work I will do. And if the person can make happen time routine also, can write that time also in the to do list. For example, to do list, for example, like office presentation, after that lunch, after that for some period of time it's a game, indoor game, after that again presentation, after that is the for example snacks time, after that is the office is closed, and also after that dinner time. So in that way we will do the to do list. And for example, we can write the time also for the to do list. For example, dinner time 9 to 9:30, office lunch time 1:30 to 2 p.m, and also the presentation time is the 11 to 12:30. So we will can do the to do list for the work and also for the time also. So a person who is facing the anxiety in his or her life can make the short term goal in his or her life, and in the case of the short term goal, he or she can do a to do list, and that will help for achieving the short term goal. And also after that, whenever the person is observing that he or she can achieve and is achieving the short term list for day to day life, for day to day thing in his or her life, after that he or she can also can do the to do list for the broader goal or the broader aspect of life. The short term goal will make the individual very much confident, very much courageous, and will make individual less anxious for achieving the goal. So after achieving the short term goal, the person will himself or the herself will feel a confidence from inner self, and will do a to do list for himself or herself by independently for the broader aspect of his or her life. So goal setting is very important, and also it helps us value our time and focus on something from long period of time. That is very important, because we for all over the 24/7 we waste very much time in many things that I also waste, but that we cannot even observe that how and when all the time just flow. So this is very important for goal setting. After that, the very important thing is the self monitoring. In the case of self monitoring, practicing new skill, problem solving, and also goal setting, all of the thing is included in the case of the self monitoring. If a person is setting a goal in short term process or long term process, whatever, if the person is practicing new skill, if the person is solving various type of the problem in his or her life, self monitoring is very important. That will help to give you a picture of yourself in your life. What's the strength and the weaknesses you can find by the self monitoring process. What's the thing you did for the years, what's the thing you are doing for the past days, for the present days, what's the thing you will do for the future. The self monitoring will very grateful for you. And also, what's the positive things, and also what's the negative things you are carrying in yourself, your orientation of particular thing. All of the thing we can we can observe by self monitoring. And that the process, the self monitoring we can do by writing a diary. And after writing a diary, whenever we will get some time, we will read that diary. So that diary will be a reflection, like a mirror of ourselves, and that will reflect our positive and negative, all the things of ourselves, and that will make us a better person in day to day life, and most healthy, and also most healthy mentally and also physically in our life. And therapists sometimes always try to use these things to know about some information about the person. So after that, the thing is how CBT can help. So, CBT can help in case of the insomnia, relationship issues, bipolar disorder, anxiety, depression, panic attacks, and eating disorder. Whenever we are trying to do the CBT, we have to always try to remember the thing that we are trying to change the behavior by changing the cognition of the individual. So all of the thing can change whenever we are trying to change our cognition. So main thing is that changing the thought pattern or thinking process. Whenever we will change the thought pattern, automatically our behavior will change, and automatically all the difficulty that we are facing in our life, try these things, and automatically all the things that we are facing in our life will eventually resolve and reduce gradually. So all of the things we can use, all the process, for example, like practicing new skill, problem solving, self monitoring, and goal setting. This is the main thing of the CBT, and we can apply in the case of the CBT whenever we need, and especially all the things we can apply in the case of the all of these problematic things. So thank you for listening me, and also viewing my channel. And I am always try to do some interesting topic to provide you, and I am always trying to provide you the topic in more interesting process. So I am trying my video in more and more what to say, advanced way. I am a beginner of the YouTube channel, so I am trying my level best. So please view my channel and listen me on my YouTube channel, and please help me, support me for doing all the things in a very easy way. I am trying to provide the information whatever I know. It can be wrong, it can be right. I am a beginner, so I am trying my level best to put you the most accurate and the right information in front of you. So thank you people, and I love you all.